Everybody, my name is Kelly. I'm one of the injectors here at Monarch. Just wanted to share about some things to think about before your toxin appointment. So there is a small chance to bruise when we do Botox or Dysport. The needle we use is pretty tiny, so it's not as big of a chance, say if we were doing filler, but still you may want to stop anything that can contribute to blood thinning products or easier bruising. For instance, supplements, omega-3, fish oil, ibuprofen, aspirin. Maybe don't drink wine the night before, things like that. And then the other thing is just remember it does take a couple weeks to fully kick in. So if you're doing it because you have an event coming up or vacation, just schedule that a couple weeks prior to make sure it's kicked in. If you're a returning patient, if you're new, you might want to do it several weeks before, maybe a month, so we have time to tweak things at 2 weeks if need be.
Botox works by blocking the brain's message to the muscle to contract, and it relaxes that muscle in the opposite way of how the muscle pulls. So when we're talking about in this area, these are depressors. So when we relax it, it can actually relax up just a little bit. Results are not immediate. It often takes about 7 days before you start to see anything start to happen. And then by about 14 days, things have finished and we can take a look and see if anything needs to be added at that point for optimal results. Most people feel like by 3 to 4 months, they are moving again, their muscles are moving again to the point that it's appropriate to go ahead and have another treatment. Static lines, the lines that are at rest in the muscle when you're not contracting it, sometimes they will completely smooth out with one treatment, and sometimes if they're on the deeper side, it can take some consistent treatments with an appropriate dose before you really see improvement there.
After your Botox or Dysport treatment, we do want you to avoid exercise, heavy lifting, or laying flat for about 4 hours after your treatment. We also want you to avoid makeup directly over the area for about 24 hours, so by the next day, you're fine to go ahead and apply anything that you want. I also recommend keeping your skincare gentle and light, so a gentle moisturizer, gentle cleanser would be great, but do avoid retinol products, exfoliating, or any face masks that would be harsh on your skin.